Hi, everyone. Thank you for joining us. My name is Michael Stewart. I am here with the OI Foundation. And today we're going to be talking about, as the slide says, physical therapy, exercise, and OI with Christopher Joseph. Uh, for today's session, this will be roughly an hour long. As you may have noted, we are recording this session. This will later be put on the OI Foundation's YouTube channel, where you can find it there in the next few days. Uh, you, for today's call, I want everyone to please note that please keep your microphones muted during today's session. That way we can best hear the information being presented to us. We'll have multiple opportunities throughout this call where the speaker, Chris, is going to be asking the audience questions, and there will be sections where we want to have Q&A and answer as many questions as possible, but please just save it for those moments. If you do have any burning questions and you don't want to forget them, feel free to write them into the chat, and that way we can look at them and see them later on. The other announcement I wanted to make is that this session, like other OI Foundation sessions, is meant as public information, and this is not meant as an opportunity for telemedicine for the audience. So even though some questions may or may not apply to some of your personal circumstances, this is not a space where you'll be able to get individual medical questions answered. With that being said, I want to introduce our speaker today, Dr. Chris Joseph. So he is the head of physical therapy at Kennedy Krieger Institute and also at the OI clinic at KKI. I've had the pleasure of working with Chris for multiple OIF conferences and multiple events. He is a real expert in the field, and we are so thankful to have him here with us today. I'm going to just unshare my screen and just say, Chris, thank you so much for being with us.
Thank you for inviting me. I appreciate it, Michael. Thanks. So we're going to talk about today about the impact of osteogenesis imperfecta on muscle, tendon, exercise, and health, because I'd like to give you a little bit of background about muscle and tendon and energy consumption as well as part of this presentation. And then, I'm going to try as best I can to offer opportunities for people to ask questions. And I have some scenarios in here. Michael was gracious enough to give me some scenarios that we can talk about for exercising. So they'll be towards the end, but we're going to try. So the first beginning is a little bit of informational stuff, and then we're going to move from there. So I have nothing to disclose at all. No. And my objective today is for help you guys understand some of the muscle structure and function that happens with OI, to understand the effects of impaired collagen on your energy and your fatigue. I want you to gain understanding of the interconnection between muscle and bone. It's a really important connection that kind of people don't always pay attention to. And I want to gain an understanding of how to exercise with OI. So I'm hoping that kind of stuff can be translated as well. And understanding the effects of impaired collagen on pain, because I know pain is a big factor that occurs with OI, and a lot of my adult patients that I see with OI, have a ton of pain. So let's talk about just in general, there's muscle weakness with OI, but what does that weakness look like? People with OI generate less peak force, and this also varies by OI variation of level. They have a decreased ability to sustain the peak force, right? They can't hold a contraction as long, and again, it varies by level of OI. And then the mutation also causes abnormalities in specific gene causing mutations that also impact the muscles. Yeah. So if somebody with type 1, there could be two people with type 1 OI, and the gene mutation may be different in them, and their muscle strength, even though they're type 1, could be different between those two gene mutations. So some of the mice models show that there's a disorganization in the cell walls that happens and the structure for people with OI. So the force of your muscle creates can't be translated as well to the tendon and the bone, which is important to be aware of when you're exercising. And some of the changes in the cell wall caused by the changes in FAP cells, lead to muscle, it can impact muscle development as well as muscle regeneration and fiber composition. So the composition of the fibers in your muscle is also different if you have the condition of OI. So we know from some of the mice models that muscles are smaller and they have less fibrillar collagen. It's a pretty technical word, but the fiber sizes and the distribution of those muscle fibers is normal, but there's a smaller cross-sectional area that's available in the muscle for people with. And this again leads to that less of a peak force and the ability to sustain a force when you're exercising. So we know there's reduced amount of muscle mass that relative to body mass, and my adult patients with OI really don't get mad at me, but just, say to me all the time about I don't want to hear this as much anymore. But sarcopenia is clear in people with OI. So the aging process from muscle and the age-related weakness that happens with adults with OI happens sooner and faster if you have this collagen disorder versus what happens in the standard population. So your muscle mass decreases and your strength gets um, it decreases sooner than they call this sarcopenia. So with aging. So let's talk a little bit about some of the other mice models about, endurance. This is how your endurance is impacted. People with OI have genes that have a lower number of type 1 muscle fibers. These are the muscle fibers that, are used by endurance runners, to be able to last those long distances. So the muscle of people with OI have less of these type 1 fibers. So there is an opportunity for more fatigue there, due to those lower number of muscle type 1 fibers. We also I want to talk about, and this is important, I think that relates back to your pain issues. The pain issues is that, TGI beta signaling is a process by which, the osteoclasts that break down the bone release this chemical called TGI beta, and this signals the muscle to actually respond. And people with OI have an increased amount of TGI beta signaling in their muscles, and this really leads to an increase in persistent inflammation. So your muscles and your tendons are persistently inflamed, right, due to this TGI beta signaling, and that leads to further fibrotic tissue formation and decreased muscle mass. Dr. Brandon Lee down in Texas is doing a lot of research on TGI beta, and I'm really excited about some of the stuff coming out of there. And I'm really hopeful that this can impact not only the muscle bone density in people with OI, but also the pain and the inflammation associated with the condition as well. So we're hoping some good stuff come out of Texas from that. So again, the TGI beta and the myostatin leads to inflammation and fibrosis and body pain, but also the stress on your joints because your muscles may be weaker, and the biomechanically compromised muscles may also lead to more pain and inflammation in people with OI. So getting back to mitochondria again, I want to tie this into some other things that are happening. The genes for mitochondria are less effective. This leads to a decrease in mitochondrial activity in people with OI. You feel fatigued because your mitochondria cannot take that energy and produce it as effectively as somebody with a muscle doesn't have OI. And this mitochondrial decreased activity leads to what's called nutrient excess. So there's excess of the nutrients used to create the energy in your body, which can lead to impact your weight and lead to obesity. So you get in this cycle, as we'll go on the next slide, where you gain weight. This leads to some obesity. This leads to further nutrient excess, and this further nutrient excess impacts the mitochondria even further. So you get in this cycle of your mitochondria and your muscle can't produce enough energy, because of the excess nutrients, and then it makes them more and more less effective. So this is some things that are becoming that are really evident in people with osteogenesis imperfecta. So this leads to a clinical presentation of people with OI where they can get more fibrotic tissue in their muscle and almost in the severe cases, look like a muscular dystrophy. The muscle weaknesses also can lead to, as we know, can lead to decrease in bone strength. And then we talked about the mitochondria and the type 1 fibers can further lead to further fatigue and weakness and tiredness, when you're working out, when you're moving. So I'm going to move on a little bit to talk about some tendons. What happens with your tendons with OI? So you have what's called atopic chondrogenesis, what occurs. So the collagen kind of builds up in some of your tendons. This can negatively impact your tendon repair. This can lead to some of your hardening of your tendons. And again, there's another reason for the inflammation, right? So you have, again, more inflammation happening at your tendon levels, again, due to that TGIF beta signaling, which is occurring, from your osteoclasts. So deformity can also change the muscle tendon position. So this can impact the effectiveness of the muscle. This can decrease your range of motion and cause contracture, which can lead to pain. This can impair your body mechanics. This can impair your joint mobility, but also lead to joint hypermobility. So some of your joints may move in ways that not typically seen in other joints. So this can lead to further pain and injury. Something happens, we talked about some of the tendons, how they're rigid and they're hard to, harder to move because of the collagen disorder. But this also can impact what's called the Golgi tendon body, which is the signaling mechanism in the tendon. This body's designed to give you like joint position and let you know where you are in space when you're walking, help you identify the effective position to move while you're moving. And this can cause, since your tendons are harder and the signaling mechanisms is not working as effective, this can cause misalignment. This can lead to bowing. Excuse me. This can also lead to, you're putting your foot down in the wrong position and an injury. It can lead to trauma and fracture. So it's important to know that, that body signaling mechanism is also impaired in tendons. So in summary, we know that muscles are smaller and have less muscle mass, become weaker faster. They have reduced force. They can't translate the force as well as to their tendons. They have abnormal signaling, weakness, and pain and inflammation from some of this poor signaling. The energy system of the muscle is impacted, by OI, less flow, so slow twitch fibers. Genetically, the mitochondria are all impacted, so they can't, use the energy as effectively. And then they get into us, you guys, people with OI get into a cycle where, obesity also impacts their mitochondria, and this leads to, more impact on their energy and fatigue. So I'm going to talk quickly one thing just about nutrition real quick before I move on, because it's really important. I'd like to really talk about the fact that, healthier diets can improve mitochondrial function. So, it's really important, and talk a lot about Mediterranean diets, right? We need to talk about the research. It's the Mediterranean diet, which really leads to the improved mitochondrial function. So diets high in high in fats and carbohydrates can lead to increased TGF-beta signaling, and we know that TGF-beta signaling leads to further inflammation, impacts your mitochondria, causes more fatigue, and also leads to pain and inflammation. So I wanted to really talk about that a little bit, so that how important nutrition, even though we're talking about exercise today, I wanted to talk about how important nutrition is as part of this process. So here's a question. It's kind of not really asking you to answer, but it's I'm going to ask what's one of the most important treatment modalities for muscle weakness: low impaired bone density, impaired proprioception, and postural coordination with people with OI. It's muscle strengthening. So we're going to talk about the next couple slides about muscle strengthening, get into the meat of this, and start to ask some questions. So let's talk about muscle strengthening and OI. So it's a great way to combat some of the things that are going on. More physical activity leads to more strength. More strength leads to more stability. More stability leads to more shock absorption for your bones, less likely to fracture. This is really evident in the more severe types of OI, type 4 people who use or ambulate with crutches and without crutches. People who ambulate with crutches, their bone density and their strength improves in their upper extremities, where people who ambulate without crutches, their bone density and their strength, increases in their lower extremities. So it's just evident that the fact that, using your muscles is important for a person with OI. Again, this is shown in some of the benefits that youth have got. The greater physical activity increases their bone density, increases their peak bone mass, impaired collagen. This is important to identify that even though the muscles are impaired and the collagen, the collagen is impaired in the bones, the low peak force that your muscles produce when you have the OI condition still is above the bone formation thresholds, right? So even though you're generating less force than somebody else who doesn't have OI, you still generate enough force for your muscles to cause bone formation and bone growth. So, the bone adapts to those forces just like healthy bone does, and the bone will act upon the stress that you give up, that you act upon it. So that's why driving, we've thought for years that weight bearing and standing was the important thing for build bone, but it's actually muscle pull, right? It's the muscle pulling on the bone, which causes you to build the bone density. And that's the most important thing that you need to do, is not passive weight bearing, it's active weight bearing is important. So we also know that muscle strengthening increases aerobic capacity, right? Decreases that fatigue, makes those mitochondria more effective, reduces pain, right? Increases bone density, improves function, has a positive impact on anxiety, depression, right? You really get those endorphins going, and it makes you feel better when you exercise. It decreases the formation of contractures, right? Contractures lead to pain. It also decreases the fibrosis formation in the muscle. And then we talked about the TGI-beta signaling. We'll talk a little further that exercise actually impacts that as well, and can decrease that pain and inflammation. So again, the muscle strengthening decreases fibrotic formation in the muscle, so inhibiting the fibroblast activation and probiotic factors, right? Exercises and resistance training can reduce activity of fibroblasts. These fibroblasts is what typically causes pain in your muscles, and they're responsible for producing the components of scar tissue. So the better you exercise, the more exercise, the less likely you are to get the scar tissue and the fibrotic formation in your muscles. As I said before in the slide before this, muscle strengthening decreases the expression of that probiotic TGIF beta, and this is a key factor signaling for muscle fibrosis. But it also, evidence is showing that increased TGF in your body causes pain. So some of the bone pain you may be feeling is that extra TGIF beta signaling. If we can impact that with exercise, we can make that bone pain or that pain go down. And then, it also helps modulate factors and helps, produce less scar tissue that happens typically with OI and more fibrotic formation. So there's no real evidence on a protocol for strengthening, but there are some things that that are important to follow when you're exercising when you have OI, right? You want to adjust according to the severity level, right? The more severe the condition, the more stress there is, and the increased, so we want to work, we want to work on reducing the stress on your I'm going to talk about different. I'm sorry, I apologize. I'm going to talk a little bit here about difference between kind of like strain and stress, and torque as we go along, but you want to reduce the stress and increase the stability while you're exercising. You want to reduce the lever arms. I'm going to get a little more detail about that down the road, but lever arms are important to be aware of when you're exercising. You want to reduce those lever arms and reduce that torque on your muscles and your bones. You want to maintain your alignment. It's really important, right? Balanced alignment is important when strengthening with OI. And you want to focus on, joint stability, and a balanced muscle is a much better shock absorber than a muscle that's overpowered on one side versus the other, right? So both muscles of the joint want to be strong, not just one side of the muscle I'm sorry, both muscles around the joint need to be strong, not just one muscle needs to be strong. So let's talk a little bit about, I talked about how, I think I get this a lot in some of the lectures I do with why people talk about how they're, worried about damaging their tendons when they're exercising. So let's talk a little about how to exercise an impaired collagen tendon. I've heard stories of people saying to me that they go to exercise, they tear a tendon or something, or that when they're exercising. But so it's really important to properly exercise a rigid tendon. So we want to, we want to increase the stiffness. I'm going to this before of the tendon and not strain it or increase torque. So these are really important. You want to the stiffness is built even though the tendon's impaired. You can still build stiffness and make it and make it strong and make the tendon strong. You can lower them even with lower amounts of collagen and biomechanically compromised muscles. You can still again build that stiffness, but you want to be careful of overtraining, right? Overtraining can lead to an overuse injury or a strain or an injury to a tendon. So you want to be balanced and remember to pace yourself while you're exercising with your tendons, exercising your impaired collagen tendons. The other thing is exercise is proven that long-term exercises causes reshaping and improvement of tendons where, short-term bouts of like, I'm going to do exercise today, but then I'm not going to exercise for another 2 weeks, right? That does not help the tendon. It actually can lead to injury because you're stopping and starting all the time. So, a long-term exercise approach can increase the cross-sectional area of your tendon. It can improve the tendon muscle working together and causing, again, the strain. We want to increase the strain, not the stress and the torque. It can build stability. It can focus on biomechanical position. It also can work on optimizing the tendon position when you're doing that. So we want to focus on really a long-term exercise program and not so much, these short bursts where you're exercising intensely. So we're talking a little bit about tendon loading here. So these are perfect two examples of what I'm going to show you here for tendon loading. We're going to start with, a basic just body weight support squats here, and then the body stays properly aligned, and then when you want to progress from that body weight support program to adding weight to it, he's got a kettlebell next to his body, and it's really important to see the position of the kettlebell, right? It's not stretched out away from his body at all. Sorry for the camera there. It's pulled close to his body to maintain the weight in alignment when he's exercising. So you want to progress over your over your tendons and not just do what do they call that? CrossFit. CrossFit is an intense high intense exercise. You want to focus on, those kind of progressive tendon loading and work on stability and then work on stability over mobility when you're exercising with those injured tendons. You want to reduce substitution. We're going to talk about this in a couple of slides later on, but you want to use the muscle that you're exercising and not try to substitute an extra muscle, in there to help that muscle. So, you want to also avoid bone-on-bone stability. So if you want to don't want to lock your knees and stand up on legs. You want to use your muscles and have your knees a little bent when you're standing, right? To use that. You want to avoid pulling activities. We know that pulling activities in general are tough on joints. So when we're exercising, we do really, really want to work to try to avoid those pulling activities. And then we want to distribute the weight evenly through the bone, right? We're talking about long lever arms, and I'll have some pictures later on in the slides about long lever arms. You want to keep the force of the weight down through the long axis of the bone versus out on the edge of the bone pushing down. So I don't know if you can see my camera, but hopefully I can explain that a little down. So you want to have more proximal resistance like that kettlebell closer to your body when you're exercising and not further away. There we go. Again, I like to use developmental activities, hands and knees, kneeling, stuff like that to exercise. I'm going to keep a midline kind of focused position when I'm exercising and concentrate on stability first and then move towards mobility. So if you can stabilize your face, then you can work further towards moving over a stable joint. And I want to focus on control and balance. You really want to focus on controlling and balance over those joints. So progression factors. I recommend my patients either we talk with the PT or an MD or whoever's following you up about exercising before, as you're progressing. I know some of the locations for people are hard to get to a PT who can work on progression. Some of the patients I've helped across the country, I talk to the personal trainer about progression and so that's I do work. If you can get that resource to help you out with your exercise progression, it's a good idea. Again, you want to have your somebody helping you, or you want to work on, if you're doing it yourself, work on muscle control first and stability versus explosion and activity. You want to maintain, again, it's important to maintain your alignment. And I am not a fan of bracing at all, to be honest with you. I brace to support, not replace. So, I really want to be able to have that muscle active so it can protect that bone more so than actually using the brace to support to replace the muscle. So finally, I would say in general, you want to make exercise fun. It's important to enjoy yourself while you're exercising. So I know some questions came up about Pilates versus strengthening versus gait versus weight training. They're all great activities. You can do all of them if you have OI, but you want to make sure it's functional and fun as part of the activity. So. Nice slides. There we go. So we're going to talk about substitution first. This is something I really think is important to talk about. This is called a prone extension exercise. I really like this exercise for the glutes. I don't know if you guys ever read the New York Times, but the New York Times says the American population substituting is suffering from glute. It's called glute amnesia. Everybody ignores their glutes. It's true. It's one of the most important muscles to be strengthening. Everybody focuses on core and talks about you have to have core strength to stand up. Well, you have to have good glute strength too. So I really recommend this a lot for a lot of my patients. And I like this exercise because it's non-weight bearing. It's nice and easy to do, and you can do it just about anywhere. We're going to see how it plays out with the video. I might have to do the commercial. There might be a commercial in there. Not oh, great. There's not one, but you can see he gets over and the person gets over into prone. And he focuses on the bending the knee up. I'm going to pause in a second. And then he lifts that thigh up off the mat. The most important thing to be aware of when you're doing this exercise is how not to substitute to assist it. What you typically see in that substitution is this opposite leg that's on the ground. Can people see my mouse? Is that okay, Michael? Can you see my mouse? Yep. This opposite leg that's on the ground gets pushed into the mat. So you push that opposite leg into the mat to try and help lift this leg up. That's called a substitution, and that's what can lead to a fracture or an injury. Even if this thigh cannot come off the mat because your glute amnesia is so bad, you still need to focus just on that, trying to get that thigh off the mat, and do not push in the opposite and push down with the opposite. We want it. It's a perfect example of how substitution can hurt you, and we want to avoid that substitution. Let's see if it lets me advance. So we're going to do this. The next one is a hip abduction example for substitution. This one is less likely to cause an injury, but it can lead to some strain in your hip flexor. Here we go. So we're going to talk a little bit about substitution in this exercise here. Another great one I like. Everybody, this is part of the glutes. It's your AB deductors. And you're going to, keep rolled on your side. You're going to point your toe forward and you're going to lift your leg up like she demonstrates here. Just like that. The substitution with this is if you're really weak, you would roll backwards. So you'll roll towards your back, and you'll take your toes and start to push them towards the ceiling, and you'll use your thigh muscle to help you. That substitution can lead to some strain in your hip flexor, which is your little muscle that's in the little tiny muscle, in your hip area. So you want to try to, best you can, keep your body aligned or even roll forward a little bit when you're doing this exercise, trying to figure. And if it's so hard that you cannot get your leg up, there's simple little adaptations you can do. Her ankle can stay down and her knees can bend up a little bit, and she can do what we call clamshells. She can open those knees up, right, and work on that muscle again without rolling back, that substitution. So let's see here, the next one. And then I like this one a lot too. It's called a isometric leg press. Sometimes you can see the therapy ball in the corner there. I will put the therapy ball between the feet and the wall because it's something to press against and help you work on. You can start by just holding the ball on the wall as an exercise with your feet to work on the control and the stability, like we talked about, working on stability first, and then lead to mobility, pressing against the ball. But you can also just press against the wall as well. And let me see if he shows this one here. He will not do the substitution, but I'll pause it and we'll talk about the substitution as well. So he's going to push against the wall and it's going to move a little bit. You don't have to move as long as you push against the wall and contract your muscles and hold the position. The substitution with this is you don't want to point with your toes, right? You want to keep your whole foot on the wall, push with a flat foot. So the weight's evenly distributed over your shin muscles. And I would even, I'm sorry, shin bones. I would even ask him at some point to lower his legs down a little bit because he's a little high, to get that weight for somebody with OI to drive the weight through the long axis of the shaft of the shin bone. And then the other substitution you want to watch out for is those knees coming together. That's a clear sign of you're trying to use your hamstrings to help you push, and you don't want those knees to come together. So even if you can't generate enough force to hold the position, that contraction with knees apart, feet pushing with the whole feet will help with the stability and build stability around the joint of the knees and hips. This works on the entire leg, knees, hips, calves. It gets them all with this one. So now we're going to get into some scenarios from the things that Michael asked me to talk about. People sent in early. I know, Michael, you had a couple more. So if we get into a couple more questions, I can ask them as well. During one of the scenarios, it was really hard for me to kind of answer it up front. So I was going to open up for questions during that scenario. So if you have questions, as part of that scenario, and you want to talk about some adaptions, we're going to open the door to be able to talk about some of the stuff like that. So the first one is the person's Ava, who has type 3. Who really afraid of refracturing. Is it possible to strengthen the abs with a fused spine? Absolutely. It's a really nice exercise you can do for abs with a fused spine. But I also want to bring up, and I'll show you down the road, is that other exercise I showed you for the glute amnesia. So this is the perfect example of what you can do for a fused spine. We're going to take it one by one, right? You start while laying on your back with your knees bent up, and you're going to lift your leg one at a time towards your chest until both legs are off the ground. And then with the most important thing to remember is while you're doing this exercise is when you get these legs up here, your back should be flat against the surface, right? You don't want to arch. That back needs to be flat. And then what you're going to do is you're just going to slowly lower one leg at a time, first one leg and then bring it back up. And then you're going to let the other leg go down and bring it back up. So you're just doing like a gentle kind of lower of each leg. During that lower, it's really important, again, to keep that back flat against the surface. If you feel your back arching, that's another sign of some substitution, what we call substitution, and that causes increased stress on the spine. So you really want to focus on, again, keeping that back flat. Again, that's the lower abs. That's the harder one to exercise when you have a fused spine. You can do just about any kind of short sit-up for the upper abs, with a fused spine. So that will all, again, cause us some strengthening. The other one is, I'm going to not play the video, but go back to this one again. Typically, people with a fused spine really suffer from glute amnesia, and it leads to a lot of back pain. So I shift a lot of their focus away from, not so much away from, but in addition to the core work, the glute work is really, really important right now because now, in the past, before your spine was fused, you relied on your back muscles to help hold you up. Now that your spine is fused, your back muscles are biomechanically less effective, and the glutes take a lot of the strain from that. So it's really important to strengthen your glutes when you have for somebody with a spinal fusion. So that back pain, I've had a number of patients with back pain because of their glutes were so weak, and once we got those glutes working pretty good, their back pain significantly reduced. So it's really important to add this as part of your exercises for that spine stability. Oh, it's going to play the video. So, how can I adapt? This number. I think this is more going to open up some of the questions. So, how do I adapt? This is Lewis, who's an adult with mild OI. How do I adapt my PT exercises without expensive equipment? So, it's really hard for me to kind of address this without understanding what exercises you want to adapt. So, I guess I'm kind of open it up here and see if anybody wants to actually throw out some exercises that that have questions about. We're going to talk about adaptation down the road a little bit further, but if anybody had a specific exercise they wanted to ask about for adapting or a specific activity they wanted to ask about for adapting, I'm free to talk about that. I'm open to talk about that now. And we have some chats out there. I don't know, Michael, if we know what's in the chat. Looks like
So it looks like we got one person calling in from Ecuador who my colleague was giving some Spanish resources to.
oh, okay.
But, I see one person in the chat is saying they are a type 1 prone to positional vertigo when lying on the left side.
Okay.
Any recommendations for strengthening the right side for right glute strengthening?
So let me see, when they're lying on their, so it sounds like when they're lying on their side is when they have vertigo. And if we're lying on our side, we're strengthening the abductors, which is a side glute muscle. If I'm reading this right, and they want to strengthen that right side abductor. So you can be on supine, what we call supine, which is laying on your back, and I saw an exercise for this the other day. You can be laying on your side. It's hard for me to show this, and I apologize, but you can take your knee and bend it up, and you can put a small like gym ball between I bend both your knees up, the small gym ball between the side of your knee and the wall, and you can press isometrically against that ball. It's like you're doing clamshells, but you're doing them on your back, right? Your knees are bent up. You put the ball between the wall and your leg, and you can press against that ball to get that isometric exercise. The ball's a lot nicer because it's less pain, right? If you push against a hard wall, it might hurt, but so the ball will give you some support and also give you some alignment there. So we've got a new one just came in too. So adapt exercise to relieve back pain. Well, I'm sorry, I missed that one. It kind of ran off first. Adapt exercise to relieve lower back pain as well as improve bone density. Adapted. I think if I can speak to the core work I just showed earlier for those lower abs and the glute activities that you can do, any kind of that's going to reduce your back pain. There's a lot of evidence around the improving the strength of both your glutes and your core work to reduce that back pain. So again, all three of those exercises I just earlier showed, the glute prone activity with a knee flexion is adapted. Shouldn't be an issue with that. The side lying, or you can do clamshells. That can improve some of your glute amnesia. I'm going to use that word again. The lower ab work, the upper ab work is all going to improve that. That can all be done in supine while you're laying on your back. So that'll all help with some of it should help with some of your low back pain. I would really focus, again, I'm having a lot of success with glute exercises for back pain. So I would really focus on your glutes as part of this. So a 2-year-old child with type 1, building off a question, suggests exercises for balance and body awareness. So I would focus a lot on midline positions for your joints. Some of the kids that I work with enjoy what we call a Bosu ball, which is a half ball mounted to a surface, or even a surface that's semi-flexible, standing up in a midline position with feet, knees flexed a little bit, hips flexed a little bit, and working on just standing in that position, doing catch throw kind of things is something you can do. Stairs actually are really good for building body awareness and balance, because you really got to make those steps, stepping up and down the steps. Type 1, I would even do a little bit of jumping. Some of that trampoline work I would work on, as long as you're landing in a midline position. Kids probably love trampolines and the pool. I'm a fanatic with the water. So I do everything in the water, swimming, walking. I've even taken like weighted medicine balls and stuck them in the water and had the kids push them with their feet. We played soccer a little bit in the water with the wet. I mean, you don't want them to kick it, but you can work on pushing that ball in the water to be able to exercise and move around things. So from Canada.
I
Uh,
was just reaching out to that message just to the
okay.
person asking that question. If they want
Okay.
to reach out, and I see my colleague also did the same. If they want to reach out to us at bonelink at
Okay.
oif.org, we'd be happy to give them more resources for that question.
Okay.
Just
Perfect.
because it's not quite PT related and our time is limited. So I want to
Okay.
stay true to the topic.
Okay. Anybody else have any questions before I move on to the next one?
I see one last question.
Awesome.
Actually, I see another one just snuck in. One is about what are your thoughts about TheraBand?
So I like TheraBand. I again it's just like weights.
Can you also
You
explain what is TheraBand?
Oh, sure. So TheraBand is a rubber band that looks like a thick sheet, and it comes in long strips, and you can tie it in knots and use it to exercise with. I don't have any with me.
I've
Um,
got one in my closet, even right here. Mhm.
but the thing about TheraBand you have to be aware of, just like with as we talk further in this about weightlifting, you want to be proximal with your positions and your location of your band, right? So if I'm exercising, and I'm going to try the best I can, let me move my camera a little bit here. If I'm exercising with the band and I'm holding, the band and like exercising, I'm going to work on my shoulders and I'm going to pull the band apart. I'm going to put it like strap it to one side of my wrist and then the other side of my wrist and pull it apart. That's for my shoulder exercises. If
Mhm.
you're with OI, you do not want to have the band down away from the long lever arm on your wrist. You want to have the band proximal. All your TheraBand activities for OI should be proximal. So you want to keep the band as close to the center of mass as you can when you're exercising, and that reduces the risk of fracture. Also, reduces the stress and the strain on your tendons and
Can you
offers.
clarify again? I apologize to interrupt you. Can you clarify again what you mean by proximal?
So closer to the body. So we saw that gentleman who was lifting the kettlebell close to his body, right? That's proximal. Distal's away.
No.
Proximal
Gotcha.
is close to your body. So you're going to approximate the location of the weight to your body when you're lifting. So,
Thank you.
yep. Flat bands are great. Somebody said that just
Mhm.
saw. So. So if I can come back to another one if I miss it, but I want to move on to the next scenario because it talks a lot about weightlifting, and I think that's important for us to address because I'll talk about this as part of the TheraBand exercise and can be applied with TheraBand as well. So we have Jordan, is middle-aged adult. He wants to build some strength. He's worried about is late lifting safe with OI? Absolutely. Even though he's had, balance issues and partial patella tendon, we're gonna find activities or exercise that can reduce the stress on his patella tendon. So let's talk about weightlifting. So, and I used this word before, and I apologize. I will close to the body rather than proximal. If you look at these two positions, there are two ways to exercise your shoulder. So the one is what we call a forward lift, and you can see the muscle. It's colored here as he's exercising. But this exercise puts a lot of torque. That's the word we're trying to avoid, and stress on the bone and joint, right? So this is not a position you want to do the exercise. But if you see this young lady over here, the joint, the weight is close to the body. We call that proximal. And what she's doing is she's pushing up the weight and it's driving the force down through the long axis of the bone. So the more you can do that kind of weight training exercises, the less likely you have of fracturing and the more proper stress you're putting on your muscle and your joints and your bones as part of the weightlifting exercises. I have another example. Let's see if it moves. It doesn't move. I have another example here of bench of chest or pecs exercises for your pec muscles, right? We have a gentleman over here who's doing what we call flies, right? You can see the weight's not proximal. It's away from his body, right? It's causing a lot of stress on his bones and his tendon because the weight is so far. But if he does this one, it's again, he's driving the weight and the stress down through the long axis. If we're talking about therabands, right, the theraband would be in the hand and it would be kind of tied to the floor somehow, and they'd be pulling the band up. You want to avoid that. You want to drive the band, you want to push the band up, right? So the band will be, in this example, would be holding the band in his hand, and the angle of the band would be straight down to the floor, so he'd be pushing up on the band, if that makes sense. So yes, weight training and weight lifting is safe for people with OI. It's a matter of how to properly do it, keeping those weights close to your body when you're exercising and driving your force down through the long, what we say is the long axis of the bone, driving it down through the bone and not driving it across a small cross-sectional area of the bone, if that makes sense. Um, so we have a Rena who's a type 4 who has a non-union fractures hip and upper arm. What's a safe way to get in shape without swimming? I love swim. I mean, I wasn't sure about this question whether we meant swimming or just the pool. There's a lot more things you can do in the water that aren't swimming. You know, even with a non-union, you can do weight-bearing activities. You can do walking. You can do, water weights, which is those weights with floats on them. I have an ex but and I have a slides down that looks like that kind of stuff. But one of the really nice things for exercising is Dr. Raggio out of the Hospital for Special Surgery up in New York has a really nice video. I won't play the video for you here, but has a really nice video on how to exercise while in a wheelchair. It goes through all the exercises for both lower and upper extremities. It's a great video, so I wanted to let you guys know aware of that. I think it's also available, Michael, through the OI Foundation, right? Don't they have links for this out on the OI Foundation as well? So really great video about exercising. But you can do one of the leg pedal bikes. They also work as well. You can do one of them as well, as long as you're pedaling and not riding. That's the other question. So let me see if I skip on this one. So we have Malik says the severe teen with balancing improvement, low risk. What exercise can we do to increase mobility with the low risk of fracture? Here's where I'm going to focus on the pool. For my patients with severe OI, I think water is an amazing thing. We really want to work on balance and control. And this also applies to the one we talked before with the non-union as well. You really want to work on balance and mobility in a low risk fracture area. The pool's great for this. You can do things like walking, like we're doing here. You can do things like, here's an example of a water weight. So I strap the weight around the calf. Again, it's proximal to the knee. It's close to the knee. It's not at the end of the foot. And the activity that she's doing is she's letting it float straight up. So her knee bends at 90 degrees and she's pushing it straight down, right? So she's letting it float straight up and she's pushing it straight down. Again, driving the force of the water weight through the long axis of the shin, and again reducing this cross-sectional stress on the bone that happens there. So there's also I also love doing steps. You can put an aerobic step in the pool, and you can go from like 90% weight bearing in the water to like 75% weight bearing, stepping up on that simple step on the right and the left. You can do it while holding onto the side if your balance is impaired in the beginning, but you can also do it without holding on if your balancing control is good enough for that. That was all my scenarios. I do talk quick. I wanted to say thank you to the Osteogenesis Imperfecta Foundation for letting me do this lecture. I did also put the physical therapy guide up here for you guys. If you wanted to grab that guide for physical therapy, it's available at the OI Foundation. Before I move on to the next slide, I don't know, Michael, if we did have any other questions that people wanted to talk about or things that they wanted to bring up as part of this that I didn't address. I see. I'm trying to open up.
First off, I just wanted to say thank you so much, Chris, for speaking with us. This really shows that there's so much to this topic. There's also so many misconceptions and also questions that people have about, physical therapy and exercise and OI. We're so thankful that you spent time talking with us today. We still have just about 15 minutes, so we're going to try to answer as many audience questions as we can in that time. I see that the QR link here should bring you to the OIF's PT and Occupational Therapy Guide. That is a great free resource for anyone who's interested. I know this is something that we've had for a few years now, and a lot of people have found it very helpful. I think, Chris, unless you have other thoughts, I want to jump back into some of the other audience questions
Absolutely.
we had before. So one is, so this is somebody asking about, can you clarify what exercises fall under pulling activities that you mentioned earlier?
Sure. So pulling is, anytime that you start with and it goes back to that word I used called proximal, right? the pulling activity is anything that's away from your body and you're moving towards your body is a pulling activity. So a row is a pulling
Mhm.
activity. A lat pull down is a pulling activity, right? Uh, uh, a curl is the one that goes that kind of bounces either way, right? It's definitely like a bit of a pulling activity, but it also, since it is proximal when you're curling, I've had people do fine with like bicep curls. But anything where the activity is starting away from you and moving towards you I would consider a pull. Same idea with the your legs, right? You strap the we talked about the TheraBand around your ankle. You strap the TheraBand around your ankle and you start with your leg away and you pull back towards your body with your leg. That's a pull versus a push, which you know kind of push it away with your foot. That makes sense. Does that make sense?
Mhm. Absolutely. So the next question I see here is, so they're asking, is swimming an exercise you would recommend, given it activates multiple areas of the body? I feel like I know your answer to this question. However, the other question I think that I have that is related to this is, does that count as sort of like a active or passive exercise in how you were framing them before?
So active. Swimming is an active exercise, not a passive.
Okay.
The thing to remember when you are swimming though is, you can impact the lever arms. Again, lever arms are important for swimming activity. So when you if you talk to a competitive swimmer, they'll tell you to drive your arm forward, keep your elbow fully extended, and drive your arm down as a unit through the water, right? That motion is actually putting a lot of stress, on your hand when you're doing it. So some of the things I recommend with OI is driving, instead of driving down, is to actually drive forward and across as a better, like more like a breaststroke is better than a fly, if that makes sense. Does that make sense?
Hmm.
Less likely for injury over a breaststroke than you do with a fly. So be aware when you're swimming.
Gotcha.
Yep.
And then I'm going to lump two questions together because I feel like they're related here. So one person is asking about recovery time in between exercising. And I think in my mind, I view this in terms of specifically weightlifting, but I guess it could be any. And then somebody else is asking a question in regards to weightlifting about what are your thoughts about very heavy weightlifting that has become kind of more popular now?
Yeah. So going into the heavy one, there is I did a book chapter a couple of years, about 4 or 5 years ago, and one of the articles we found was a case study on a person with type one or I think it was a type one or type three OI who was a bodybuilder. And over the period of time, he continued and he looked like a bodybuilder, but he had something like over 800 fractures, right, along the time where he would have to recover and weightlift again and have to recover and weightlift again. So I guess if you're looking to have to manage that and deal with that each time, I guess, it's more like it seemed like a personal choice for him, if that makes sense, Michael. Like
Mhm.
he
Yeah.
was willing to sacrifice the fracture in order to make him, to compete in his bodybuilding activities. Does that make sense?
Mhm.
Do you think that kind of answered the question? So it would be it'd be a personal decision. I would look for people who want to do heavy weights. I would still work more on stability than I would be on that explosive. We call that explosive.
Gotcha.
Yeah.
It is, so, but I also note that does not sound like a hard no from you.
No, it's not a hard no, right? Because it's a
Yeah.
personal choice. It's always a personal choice, right? Okay. I,
Mhm.
I saw it in the chat. Somebody asked why I stay away from the pulling activities. I don't know if that person's type one who does pulling activities a couple times a week. There are people out there that with OI that can, do pulling activities. We just recommend in general that, pushing is safer than pulling. So I'm not just like the power weightlifting is something you can't do. It's not something you can, yeah, that you can't do, but it's just, it's safer to do a pushing activity than to do a pulling, and it puts less stress on your joints. If that makes sense.
Mhm.
Oh,
So,
so is it heavy weightlifting programs to build bone for osteoporosis? So let's talk about building bone, right? So it's not the weight that builds the bone, it's the muscle contraction. So if you can get the same muscle contraction from less weight, you're going to still model that bone better. Does that make sense? So there's no evidence that shows that somebody who weightlifts and builds that does bodybuilding has a denser bone than somebody who just does like an endurance runner who does like endurance training, right? It's still the physical activity of the moving the muscle that causes the bone density increase. I guess that's what that's what I'm getting at. So
Hmm. I see a question from earlier. I just want to make sure we don't skip it. So
okay.
I understand that you made a comment earlier about the use of braces. Do you have any recommendations for my daughter who is 1.5 years old with type 3 or 4 with lower extremity deformities? She is just starting to walk independently now. We are obtaining AFOs in 2 weeks. We want her to be stabilized and reduce the risk for fractures, but we also do not want her to be reliant on them and be able to continue to walk independently. Do you have any advice you can provide on how often to wear and when?
Yeah, without seeing her, that's a hard question to answer, Michael. Without seeing her and being her
Yeah.
physical therapist, it's hard for me
Mhm.
to kind of just make those treatment recommendations.
Yeah.
But I can say you should really have a conversation with your PT around being able to keep those muscles strong, those calf muscles strong while you're using those AFO, while you're using everything. And there is a spot for braces, right? It does offer stability if there's a risk of fracture, but you really want to keep the muscles strong, they're using the AFOs around. And there's evidence that show that some of the kids bouncing kids who use AFOs or kids that didn't use AFOs, and the evidence shows that there's not much of the kids without AFOs have less likely chance of fracture in the future, down the road. So, but again, it's more of a conversation with your physical therapist, and just the recommendation from in general is to keep the muscle strong to maintain that bone density rather than relying on the braces to be able to do that. So
Mm.
balance. It's always going to be a balance. So
Gotcha.
finding
Thank you.
safely. Yeah.
Do you have any recommendations for weight loss programs or approaches?
I'm a exercise and calorie counter myself
Mhm.
personally, and we get most success in the clinic from doing that. Again, I focus back on the type of diet that they find is most effective with people in general is that Mediterranean diet. It's good for you, right? Less of those carbs, less of those sugars. But my recommendations typically is people with OI we see in the clinic is to see the nutritionist and talk about in a diet and have the nutritionist and the physical therapist work together to figure out that diet and exercise balance that helps you with weight loss. So
Absolutely.
I think I'm going to advance this
Um,
slide.
yeah.
Is that the, oh, there, here we go. Creatine. Thanks for answering the question. With respect to the issue of fatigue, mitochondrial dysfunction. What are your thoughts on CoQ10? So we do have some of the mitochondrial clinics at Kennedy Krieger do use CoQ10 and Q10 enzymes for mitochondrial disorders specifically. But I am not aware of any evidence in OI how the CoQ10 can infect the mitochondria. I am aware of evidence how exercise and how better nutrition can affect the mitochondria in people with OI, but not how the CoQ10 enzyme and creatine affects them. So sorry, I really can't answer that one. Oh, collagen. I'm going to divert that one to the doctors. Collagen supplements for building bone. I'm going to move that on to your endocrinologist or your orthopedist or whoever's managing your bone density and doing any kind of bone density management. So as a physical therapist, it's hard for me to comment on collagen supplements for bone building. So
While we're waiting for some other questions from the audience, we had some from the registration chat
yep.
that I thought were particularly noteworthy. One was, so, the person is looking for recommendations on cardiopulmonary exercise in addition to weightlifting, and their question was, when do you know that it's enough with OI? How do you determine how much is enough with OI?
That's a good question. I'm as the clinical professional, I'm looking at the patients in response to substitution. So I'm at the point when they can't keep the proper position, or the point when their fatigue is such that they need to take a break. They should probably take that break and follow their body's lead. But I would also look at how your position is or how your body awareness is when you're running. If you feel like you're misstepping, if you feel like your knee's out of position, or you feel like when you're weightlifting, if you can't maintain that proper, squared up body alignment, that's an indication that you're probably done and need a break for that position. So as a trained eye, I'm looking at that and watching them move and saying, okay, you're having a hard time with this, let's take a break. But they can feel that as well, like when they pace themselves. So
Gotcha. I want to ask one other question from the registration as well, which was so right now we are speaking with an expert in the field of OI. Uh, in your opinion, are there moments where, so obviously not everyone lives near the Baltimore area and is able to see you as their PT provider.
Right.
Um, for people living in other parts of the country or the world where there is not someone of your level of knowledge, uh, do you think that when should they be looking for OI expertise in physical therapy versus seeking a more traditional mainline physical therapist?
I think access is important, and I would say that if you know it if it depends on how I guess how much resources you have in order to see that specialist, right? If you have the resources to travel and see that specialist, then I probably would see the specialist. But if you don't, I think the OI Foundation does a great job of taking your local physical therapist and introducing them to somebody from the OI Foundation who's just an expert and helping that physical therapist learn how to properly exercise and treat that person with OI. So I think that the OI Foundation is fantastic at that, and I get those emails quite often, and still continue to happy to do that. So I would direct you back to the OI Foundation and say, let them get your PT. If access is an issue for you, I think access is important. If access is an issue, if you let your local PT get in touch with the OI Foundation PT, they do a great job of that, Michael. Actually, do
Oh,
tell.
and we're very thankful that you answer all of those emails from us.
Yeah, yeah. So
I know our
there
community.
was one up here about muscle strength and more quickly, and I want to address that because I think that's an important thing that I didn't, and I apologize, pull up in my presentation. But there's times when people with OI will be doing an activity and all of a sudden it'll hurt immensely, and then the muscle will go weak, and then they can't weight bear or they can't do something, and it's reported as, oh, I broke a bone or I fractured, and then they go to get an X-ray, and then there's a micro, there's no evidence whatsoever that the bone was impacted, and there's this thought that there's a micro fracture that's happening, and that's what's causing the pain and the weakness. I actually and having a lot of success with treating those patients as in the muscle got injured and not the bone. So the muscle becomes instantly weak from that activity. I've had it happen 6 or 7 times, after a PT session where they turn a certain way and the muscle becomes instantly weak because they injure the muscle in some way. And then we've worked on, let's take our time, let's work the muscle back up again, let's start to exercise right away, and they recover quickly versus, going through that period of immobilization and making the muscle become weaker. So I would direct you, if you do experience those activities and there is no evidence of a fracture, to definitely start to move sooner than later and work with the try to get into physical therapist, but try to get and start to really activate that muscle. You don't have to do much, you don't have to like exercise the muscle, but just activate it, contract it, turn it on, move it, get it going so that that healing process can start sooner. So that was a really great question. Thank you, Alan, for that. I really wanted to touch on that, and I completely forgot during the presentation. So
Great. Chris, thank you so much for joining us this evening. We're very thankful as always. If anyone has any extra questions for Chris or for the OI Foundation, please feel free to email us at bonelink@oif.org, and we'll get back to your questions very quickly.
yeah,
Uh,
I forget. I do have the link up here for our OI clinic too. If
oh,
you're
go
interested,
for it.
I apologize for that. I forgot to mention that as well. So here's the QR code for that. If you're interested in coming to see me over at the OI clinic, there's our web address as well as the QI. So I mean the
All
QR
right.
code.
Thank you so much. And thank you to everyone who attended today's event. You had some great questions, and we look forward to seeing everyone in the future. Have a good day.
Thank you again.